So those are the challenges.
Those are the challenges. Now, what would you like to see changed that you can think that might actually help with some of those challenges?
I think one of the effective way is to manage the finances or manage the budget properly.
Right.
I think I hear a news wherein the government slash off some budget from the Department of Health.
Oh,
So I don't know. I mean,
so more funding to the Department of Health is necessary, as well as better
Yeah.
management of said money.
that's far more important, the management.
Right. Because you can have all the money given, but if it's not managed correctly.
Yeah, you know. I mean, sad to say, I've been being here in the Philippines. After I went to Singapore, I really I dealt with politicians who really, you know,
Yeah,
under
there's
the
a-
table.
Right.
I mean, I want to be honest,
Right,
but
and I
most of the
think-
politicians do one cut. For example, if you want to do a health project in a certain area, and then for it to be approved by that city, you have to talk to the leaders. I'm not saying all, but some of them. I think that's one of the hindrance. So better managers. We should get people who knows how to manage
So a little
them.
more transparency involved in
Yeah.
the budget management.
Hence, the society in the medical fields right now are encouraging doctor to also study business management.
That's
Because
probably the
they,
thing.
for me, for example, I mean, being inside the hospital for more than 8 years, I only know how to manage the patients, how to work or collaborate with the nurses. But the knowledge or the skills of how to budget the finances, I only learned it from the master's school.
Right, because I can't
Yeah.
necessarily see how business management would be part of medical training.
Yeah.
I mean, I understand it's very important
Though-
nowadays,
Yeah, though one of the school in the Philippines already started to offer business or hospital management.
but.
I think that's a good start.
Right.
And I think medical student, the medical school should have such business management course, because if they have the awareness, they know how to manage the money, then us, the doctors, not only health protectors or health, we don't just monitor the health, but also we monitor how our funds or how the hospital funds or how the city fund be managed in terms of support to the health programs and everything in terms of health. Yeah.
Right. So it sounds to me like better money management all around is
Yeah,
probably the
Not
best,
just in the political
Mhm.
arena, but also as doctors we have to be knowledgeable in handling funds. And I really don't know how to manage the political, the corruption is really deep-seated.
Right. Now that's
It's really
something
deep-seated.
that's.
I don't know what to do anymore.
Well,
to
isn't
be
that a big
honest.
discussion now? Is how to deal with the political corruption? And I think that was one of the president's main
Yeah.
points in his election was trying to manage political corruption.
So that's why maybe I'm saying doctors should also learn how to manage funds so we can monitor.
Right. So
Right.
so
I think
it
it's-
sounds like maybe fighting back with
Yeah,
better
fighting back.
management
Yeah,
against
agree,
the
agree,
political
agree.
corruption is a pretty good option.
Yeah.
Just what are the most common ailments that Filipinos tend to suffer from that might be treatable if preventative methods were taken? Because that's something that I've seen often is that people have a medical condition that if it had been treated earlier,
Yeah.
it would not have exacerbated to the point where it's so unaffordable and almost
Yeah.
it's critical.
Actually, that's true. What's frustrating also is sometimes they bring in the patient into in the emergency room. The condition is irreversible. You can't do nothing. Something is frustrating as a doctor.
Right.
But going back to your questions, there's two types of diseases. Of course, the non-communicable and communicable. So for the communicable, still tuberculosis, HIV,
HIV is
Yes.
everywhere here, yes.
and also dengue. So this is actually one of the problems reported by the WHO that we're still suffering. There's still a lot of people suffering from this kind of diseases,
Mhm.
even if we know that there's well-proven and cost-effective intervention that we can give.
Mhm.
So where's the problem coming from? I don't know, maybe because of the knowledge of the people. For example, the tuberculosis, there's still some stigma to people with tuberculosis. There's still stigma in people with HIV.
Oh, there's a large
Because-
stigma with
Because
that.
if, for example, HIV, if the patient will take medications, then actually they can be safe, and HIV will just be like a normal hypertension.
It's not a death sentence anymore
Yeah.
like it used to be in the 1980s.
Also,
It's
tuberculosis, it's 2019 already.
Yeah.
Yeah, also dengue. So I think it's more of the education of people,
Mhm.
and of course we should stop this the stigma on
Mhm.
people with tuberculosis and HIV.